I am Mustakim from the Department of Pharmacology, LM College of Pharmacy. Welcome you all to the final lecture of COVID-19 lecture series. Today we will discuss about what care during unlock is required. Almost all the people, they are having the question in their mind that when this pandemic will over, and because of this many of these persons, they are going over the depression, and they are thinking that now what next is to be done. So for this question, we don't have answer. Only we can say that almighty god knows that when this pandemic will over. We have completed the lockdown and forced lockdown, and now we are moving towards the unlock phase. Does it mean that when this lockdown is over, that this pandemic is over or disappeared? Again, the answer is no. This pandemic situation, we are not sure that when that will be, this will be end, and this is just phase, unlock phase are started to overcome the economic burden on the country. Again, the next question, does it mean that COVID-19 pandemic over? So answer is no. We have to learn to live with the coronavirus. We have to be self dependent. So what we will do? We will continue the preventive measures which we were taking earlier. Means here we have to take care of own as well as family members. So as we were doing during the lockdown phase, we were maintaining the cleaning procedure and we were using the disinfectant. So we will continue that procedure also. As we have discussed in earlier lectures also, we will clean the high touch surfaces, and that cleaning can be done with the help of the soap, water, detergent, 0.1% sodium hypochloride, or we can also use the 70 to 90% alcohol. Now this, after opening of the offices and other corporate offices or other shops, there will be a movement of the customers, or during this we are not aware that whether this is a normal person or maybe a carrier. So now this phase is more dangerous. So what we can do, this high touch surfaces areas, that should be cleaned. So we have to pay attention more towards this cleaning and disinfection procedures. In addition to this, we will wash our hand frequently. Again, the alcohol based hand rub or sanitizers can be used, but in this we can also use the water, soap and water, that will also serve the purpose. Now what we will do when we are going out, so when we are going out, try to avoid the touch to the unknown places, or in routine we are having the habit, if we are walking somewhere from the nearby the wall, we will touch that surface, or if we are going downstairs, we are again touching the surfaces. So try to avoid the touching the surfaces, and after that we won't touch the unwashed hand to the mouth, nose and eyes, as we have discussed in earlier lecture also. And when returning to the home, what we will do, we will take a bath. First wash your hand, then take a bath and change the clothes. These are the tips which we can do, or we were doing earlier also, but we will pay more attention toward this. Don't use the alcohol based sanitizer near the flame. This will be a more dangerous, or it can lead to the hazard. Again, we will avoid the public gathering, and during this public gathering, or if we are working in corporate offices, and in that we will try to avoid the common AC area. That is, again, if one person is infected, there are chances of the spreading the infection. And as well as if the religious gathering is also permitted, try to use the uh, public toilet. Try to avoid the use of the public toilet. As well as if you are going for the prayer, then use your own materials. We will maintain the physical distancing. We won't go for the shake hand. And here we won't go for the Jadoo Ki Jappi of Munnabai MBBS. Again, in the public, if you are working as a healthcare person, if you are suspecting you are going towards near to the patient, then we will use the N95 FPP2 equivalent mask. Hand gloves use is not recommended by the public in public places, or proven benefits are yet to be established. After this unlock phase, the money recirculation will take time. So don't be panic. Just we have restarted this businesses and other things. So it will take time. Just the recirculation of the business will initiated now, but the money recirculation may take more time. It may be 3 months or 6 months also. So don't lose your emotional balance. And financial savings, we have to control the unnecessary expenses. We will go for the financial savings, and we have to take up utmost family care for the child. We are the ideal person, and if we are doing a good practices, then that child will also follow the good practices. We can also go for a jingle or some songs like, or counting games, that the child will learn about the sanitization or good washing practices. Anyhow, during this unlock phase, if you are having a cough, fever, or feeling a difficulty in breathing, immediately seek a medical advice. Now, at the end, time to test our learning. So I have just prepared a self-assessment quiz. You can type this link for self-assessment quiz, or I will also provide this in the description of this video. After clicking on this link, once you enter your name, and then if passcode is asked, you have to write enter 1234. Thanks for watching. Like, subscribe, share, and don't forget to press the bell button to to remain updated with the further upcoming lecture.